What are the best methods to keep away from knee aches in the elderly? Why does the knee hurt, and what can be done about it? Does exercise really harm the knees, and what should you do if your knees hurt after exercise? To solve knee ache problems, you must first understand why the knee hurts. Nowadays, people are increasingly aware of participating in various sports activities, especially many middle-aged and elderly people. However, while exercising, the risk of sports injuries also increases. This is because many people still have many blind spots and misunderstandings about sports, and there are also some biases in their understanding. Based on the degree of impact and torque load of various sports and exercise activities on the joints, their intensity can be divided into 3 categories. Low intensity, leisurely swimming, rowing, skiing, aerobics, golf, walking, ballroom dancing, or aquatic aerobics. Moderate intensity, bowling, fencing, cycling, rowing, skating, rock climbing, doubles tennis, jazz and ballet, aerobic exercise, weightlifting, sailing, brisk walking, table tennis, kayaking, hiking, and horseback riding. High intensity, baseball, softball, basketball, volleyball, football, rugby, handball, squash, singles tennis, running, field hockey, water skiing, and karate. Because of this, the incidence of sports injuries is very high, especially for sports with jumping movements. However, in general exercise, if the joints are not subjected to accidental trauma, such as falls or collisions, such a large injury cannot occur. The general attitude of most people is to avoid seeing a doctor unless it is really necessary. For example, in skydiving, many skydivers are injured due to hard landings, but many people don't take it seriously and think that the ache will go away after a few days. Therefore, even after knee injuries, such as falling on the knee or twisting the knee, as long as they can continue to walk or limp, many people will not seek medical treatment. But they do not know that once this injured area becomes inflamed, it may cause aches, stiffness, and swelling, leaving behind sequelae. Many people then begin to feel that it is because of exercise that the knee was injured. Although knee injuries and inflammation are not life-threatening, they can affect the daily activities of most people, thereby affecting their quality of life. Initially, the ache symptoms are usually not obvious, but then after years of slow accumulation, recurrent pain, and knee joint swelling occur, forming a vicious cycle. So, since we now know why the knee hurts, what should we do? Actually, fighting pain requires addressing joint inflammation to prevent the condition from getting worse. Especially in middle-aged and elderly people, once knee joint inflammation occurs, the ache becomes more severe, and internal effusion occurs in the joint. Certain occupational labor, vigorous exercise, and injuries can cause excessive pressure on the joints, making them more susceptible to pain and inflammation. In order to avoid knee aches, we should take measures such as doing exercises with moderate intensity and avoiding accidental trauma. Additionally, it is important to seek medical attention promptly if any ache or inflammation persists. So now that we know what causes knee joint aches, what can we do about it? Conway Ultra Joint is a combination used to prevent and treat joint inflammation and relieve joint aches. The high-quality Joint Active Factor helps to alleviate inflammation, aches, stiffness, swelling, and lower back pain, and repair joint injuries. It also reduces joint arthritis and pain and minimizes damage to joint cartilage. It has more significant anti-inflammatory, analgesic, and anti-gout effects than Joint Active Factors alone. To enhance the anti-inflammatory properties of Conway Ultra Joint, hyaluronic acid and chitosan have been added to the original formula of Joint Active Factors. Hyaluronic acid is one of the components of the natural lubricating fluid in the human knee joint. As we age, the concentration and molecular weight of hyaluronic acid in the bone joint decrease, which affects its function as a joint shock absorber and lubricant. Chitosan has good antibacterial and anti-inflammatory properties, biocompatibility, bone conduction rate, biodegradability, and adsorption performance. It is considered an ideal material for treating bone defects. It has good water retention and can effectively moisturize like hyaluronic acid, which helps to relieve aches, protect joint cartilage, and prevent joint adhesion. It promotes synovial cell secretion of synovial fluid, lubricates, cushions, and nourishes the knee joint, achieving the effects of pain relief and improved joint function. UltraJoint has excellent preventive and therapeutic effects, achieving a dual purpose of healthcare and treatment. Say goodbye to knee aches and explore the benefits of Conway UltraJoint as a natural and non-invasive solution for treating eroded cartilage in the knee. Conway UltraJoint is available in Singapore pharmacies and TCM stores. The retail price is 58 Singapore dollars only. Inquiry at 65625526, 65625526.